हाय स्टूडेंट्स, टिल नाउ हमने क्या क्या कवर किया? आयरन डेफिशिएंसी एनीमिया, मेगालोब्लास्टिक एनीमिया. नेक्स्ट टॉपिक वी विल कवर इज हेमोलिटिक एनीमिया. तो नाम से ही पता चल रहा है दिस टाइप ऑफ एनीमिया इज कैरेक्टराइज्ड बाय हेमोलिसिस. ठीक है, तो इसमें जो मेन पैथोजेनेसिस है वो क्या है? इट इज hemolysis. So it is hemolytic anemia. Now depending on whether this hemolysis is occurring inside the vessels, whether it is intravascular, right, so inside the vessels, or extravascular. ठीक है, so depending on where it is occurring, it can be divided into two types, and it is important to differentiate between these two. Now that can be done on the basis of the clinical presentation, okay, how it will affect your body, and number two will be the laboratory markers. So now coming to the pathogenesis aspect first, the normal RBC lifespan is 120 days. So that is the normal lifespan of RBCs, but it is reduced. When it is reduced, it becomes less than 120 days. In fact, it can come down to as low as 10 to 20 days. So that will lead to increased breakdown of RBCs. Right now, when this increased breakdown is inside the vessels, that will release the hemoglobin breakdown products. ठीक है, क्या होगा? hemoglobin का breakdown products release हो जाएंगे. So that will be characterized by laboratory manifestations of hemoglobinemia. Very important, hemoglobinemia, hemoglobinuria. Then this hemoglobin will get oxidized to methemoglobin, and that will lead to methemoglobinemia. Then that will be excreted into urine, causing methemoglobinuria. And also it will result in increased concentration of hemosiderin in urine, that is hemosideриnuria. ठीक है, तो ये सब laboratory manifestations है. Whereas these findings will not be present in your extravascular hemolysis. What is happening in extravascular hemolysis is that this RBC breakdown is getting cleared by your spleen and liver. So due to the presence of these macrophages in the reticuloendothelial system, these RBCs will be getting cleared off. So there will be splenomegaly. Because of this continuous function, spleen is trying hard to get cleared of these RBCs. ठीक है, तो splenomegaly, hepatomegaly will be there. So hepatosplenomegaly is one manifestation. Along with that, the severity of jaundice will be much more here. ठीक है, because of increased bilirubin, the severity of jaundice is higher in case of extravascular hemolysis, whereas in case of intravascular hemolysis, mild jaundice is there, right? There is mild jaundice. Along with that, another finding will be when there is a breakdown of this hemoglobin breakdown product, serum LDH will increase here, right? Serum LDH will increase here. Here it will also increase in extravascular hemolysis, but the increase is less. Right, so yes, there is an increase, but LDH level increases comparatively of a lesser severity. Along with that, very important, serum haptoglobin levels will be severely reduced. There will be a severe reduction. So what happens is hemoglobin will form a product, a complex with this haptoglobin, right? So hemoglobin released into the blood vessels will result in a formation of a complex with haptoglobin, and thus in return the serum haptoglobin levels will lower down. Here also serum haptoglobin levels may decrease, right? It may also decrease, but the reduction is less. So there is mild decrease. There is a mild decrease. So these are the main differences between two, intravascular and extravascular. So hepatosplenomegaly will be seen in extravascular hemolysis, right? Jaundice will be of higher severity in extravascular hemolysis. These breakdown products of hemoglobin, hemoglobinemia, hemoglobinuria, methemoglobinemia, methemoglobinuria, and hemosideриnuria, if present, they are pointing towards intravascular hemolysis. So what is happening? You should know the difference and how to identify whether the cause of hemolysis is intravascular or extravascular. Now very important students, few examples we will see that you should know comes under which category, So if I ask you any important example of intravascular hemolysis, yes, PNH is predominantly intravascular, right? Along with that, G6PD deficiency. So if I ask you G6PD deficiency is intravascular or extravascular, it depicts both, but intravascular hemolysis is much more than extravascular. Now what are the important types or causes of extravascular hemolysis? Yes, very important, thalassemia, which we'll be studying next, sickle cell anemia, Hereditary spherocytosis may show both, but extravascular is much more than intravascular hemolysis. Then autoimmune hemolytic anemia. Autoimmune hemolytic anemia. So I hope you understand that which are the important causes of intravascular hemolysis: G6PD deficiency and PNH, whereas extravascular hemolysis, thalassemia, sickle cell anemia, hereditary spherocytosis, autoimmune hemolytic anemia. Now if I tell you infections like malaria, they lead to intravascular hemolysis. Microangiopathic hemolytic anemia such as HUS, TTP, these all result in intravascular hemolysis. So I hope it is clear, intra versus extravascular hemolysis, what manifestations will it lead to, what laboratory findings will it show, and what are the important types, which type will show which type of hemolysis.